It's funny because when you first think about going to see a dentist or bringing your child to see a dentist, your initial thought is going to be your child being nervous or fearful, maybe crying or putting up resistance. You might think that you have to hold them down in the chair or talk them into getting in the chair. It's not like that at all. The kids love the dental bus. Our clerks and our drivers, they walk in and it's almost like we're movie stars here. They get so excited and they say, the dental bus is here, the dental bus is here. Can I go first? Is it my turn? And when do I get to go? I think it's just a fun thing for them. We are a school-based or a mobile program where we are made up of 4 dental hygienists. We have 2 dental assistants and 2 drivers or clerks. And we go around to actually over 100 different programs. Most of the time we see elementary schools, we see some Head Start programs, some middle schools, some high schools. And then in addition, we see a lot of adult facilities. As a federally qualified health center, we really specialize in public health, meaning that we are the safety net to catch anybody out there who may not have a dental home established. So that's our main goal, is to establish a dental home for the kids who don't have one yet. If they do have a dentist, we really hit home that they should continue seeing their dentist, but we do occasionally have parents that want their children to be seen on the dental bus anyways. We don't want to duplicate their insurance. So sometimes the parent would rather pay out of pocket to allow their child to come on the bus and have the fun experience with their friends and their classmates. And that's great. We can always, do their preventive treatment. If they ever need to be referred back to their dental home, we always urge them to go see your dentist. But sometimes it just works out better for parents. A lot of times parents don't have the ability to take time off of work. They may not have the transportation reliability to get them to their appointment. And this just solves all those problems. We bring the dental bus straight here to the children's school, and we're able to bring them out, get their dental treatment done without them having to take time off of work, and the kids don't have to miss out on a large chunk of school. In addition to the mobile units, we also have several brick and mortar sites in the area. We have offices in Bridgeport, Saginaw, Bay City, Shiawassee. We have some in Bad Axe, Imlay. There's quite a few different centers. So how we handle it here at the schools is after each patient is seen, they are given a dental report card to take home, and then they each get a phone call placed home to let mom or dad know if there is decay or treatment needed at our centers. If they do need the treatment, then we are able to make them an appointment in our offices closest to their home, and then we go in and we do the fillings or the extractions, whatever it is needed at the offices. COVID-19, when it hit, like the rest of the world, we all had to adapt and make changes. We've always had infection control policies in place, obviously, but we had to really build on that. So we started wearing our N95 masks, face shields. We started using new recommended air filter systems. So all of that changed. But we also started to see a difference in our appointments. Like the rest of the world, the dental world kind of came to a stop. And for a while, we were only seeing emergency patients. After COVID calmed down a little bit, we still were in a little bit of a lull. To be honest, I think the last thing on parents' minds were if their kids' routine dental treatment was up to date. So we really did see a lapse in care, and we're really seeing that now. Now this year, now that COVID has calmed down, our numbers are through the roof. We are so busy. We can hardly keep up with all of our schools. We've had to add more days on. We've brought extra help on to make sure that we're getting all of the kids the treatment that they need. And we're seeing kids that haven't had treatment for 2 to 3 years at this point. There's a lot of undiagnosed, untreated dental decay or cavities. And unfortunately, we see each school we go to, we see maybe 1 to 5 dental abscesses, which is an infection in the mouth that comes from an untreated cavity or decay that starts to touch the nerve or the pulp of the tooth. When that happens, you start to get an infection. We're seeing, like I said, 1 to 5 at these schools, which if we weren't here, we have no idea how long that child had been walking around with an infection in their mouth, or really how long they would have gone if we hadn't come and noticed it. So we're able to get them on an antibiotic, get them scheduled to come back and have that tooth treated. And without our care, They may have fallen through those cracks and just gone without the treatment that they needed. An untreated cavity can progress and get to the point where it starts to touch the nerve of the pulp of the tooth. When that happens, it can cause an infection, the abscess. If worst case scenario, that can spread into the bloodstream. There are some severe cases where it reaches the brain. The tooth really does need to be treated. Even though it's a baby tooth, a lot of parents think, oh, it's just a baby tooth, we don't have to worry about it, it'll fall out eventually anyways. But that affects the teeth coming in too, the permanent teeth erupting. If a tooth comes out too soon, then that limits the space available for the permanent tooth to come in. And so now you're going to have crowding. It makes it difficult to chew. Kids are in pain. There are millions of school hours lost every year because kids are having pain related to dental treatment that needs to be done. It's really important that kids have that dental work done. Even if it's a baby tooth, you got to take care of that infection before it progresses and changes the permanent dentition too. It also affects children's self-esteem. Some kids will have decay that they can see when they smile, and it stops kids from wanting to smile, or they smile with their mouth closed so you can't see the teeth, or they cover their mouth when they laugh, and kids shouldn't have to worry about that. That shouldn't be something that they think about. The parents always say, I don't know how they're going to do, or you may not be able to do anything, and then we end up calling home and they say they did great. Like, honestly, it's way easier than parents ever expect it to be.